Patuloy ang pagharap natin sa mga hamon ng bayan. At dito sa Agenda, kami ay timitindig para lamang sa katotohanan at sa kapakanan o interes ng ating bayan.
Corruption was monopolized. It was monopolized by the Marcos crony capitalists.
At higit sa lahat, tinatayuan namin ang katotohanan na mula sa utos ng Diyos.
God is with us sa battle na ito.
Pinusuri po natin ang programa at katapatan sa bayan ng mga opisyal.
You were elected by the people. You are the choice of the people in whatever position you have right now, and you're supposed to represent them and what is good for the country.
At gayon din, ang mga pamamaraan ng tapat at matapang na paglilingkod ng mga lider ng iba't ibang sektor ng lipunan.
Diyan ang komisyon. Hindi naman po yan bago. Hindi rin po yan yung mga insidente na ngayon lamang sumusulpot.
Wala pong lugar dito ang fake news o disinformation na tunay na banta sa katotohanan ng ating karanasan bilang mga Pilipino.
We must all continue to stay strong, healthy, safe, and truly free.
Samahan niyo po kami sa patuloy naming pagsulong sa katotohanan ng pag-ibig at pangangalaga sa ating bayan at sa kinabukasan ng bawat Pilipino. Dito lamang sa Agenda.
Philip Morris International says its addictive heated tobacco product, IQOS, is only for adult smokers. But a new leaked document from an internal whistleblower reveals IQOS marketing plans that suggest PMI is eyeing a much wider audience. The 2019 document from Philip Morris Japan showed the company planned to influence dentists, government officials, and other authorities, and even planned to have a presence at the Tokyo Olympics. Why? To manufacture widespread support for its harmful product. This heightens other concerns that have been raised about a flagship product from the world's biggest cigarette corporation. Experts are questioning, are the emissions from IQOS actually smoke? How much nicotine is really in IQOS? What dangerous ingredients do its emissions contain? Now, evidence suggests that tactics from the marketing plan are being used around the globe. If it is successful, PMI might be on its way to creating a new type of tobacco epidemic. With lives at stake, should you really believe what PMI says about IQOS? Learn more at exposedtobacco.org.
Okay, good morning, everyone. Good morning, our guests. Good morning to you all. Welcome to our Agenda Caphan, episode May 30, 2025. I am Twinkle Valdez, and today we are going to tackle about vaping and this HTP na talagang it's so popular nowadays, especially with the children or the youth. Yes, globally, youth vaping is on the rise. In 2022, 12.5% of adolescents in the WHO Western Pacific region used e-cigarettes, significantly more than adults. In addition, use of heated tobacco products or HTPs is gaining ground, with a 2023 study showing that 3.9 of adolescents aged 13 to 15 in the region had used HTPs in the past 30 days. In the Philippines, imagine this. The number of teenage vapers rose dramatically from over 37,000 in 2021 to more than 423,000 in 2023. Very alarming, and estimated 6.5% of Filipino youth aged 13 to 15 currently use heated tobacco products, according to the latest available data from the Global Youth Tobacco Survey. And despite existing regulations, youth-focused marketing tactics such as bright packaging, the flavors, iba-ibang flavors, there's this bubblegum flavors, the fruity flavors, that the youth are now being attracted from this to this product. So today, we have here as our guest to give us more information, details, and very comprehensive informations about vaping, about this HTP, and what are the effects that it gives to our, especially the younger generation. Okay, so right here at my right is Dr. Sophie Brasnell. She's a research associate in the Tobacco Control Research Group, University of Bath, UK, a partner of STOP. She previously studied human biology and forensic science and worked in health and social care. Her PhD centered on tobacco industry approaches to harm reduction science and whether these approaches help or hinder public health. Sophie has acquired extensive knowledge on heated tobacco products, or HTP, and tobacco industry science. And to our far right is Dr. Risalina Raquel H. Gonzalez. She's a fellow of Philippine Pediatric Society, chair of PPS Tobacco and Nicotine Control and Cessation Advocacy Group. And to my left is Dr. Mariser Glaire, adult infection disease specialist at the Makati Medical Center. She has been a leader in treatment and research on tuberculosis and multi-drug resistant tuberculosis. Working on smoking cessation. Oh, God willing, my gosh, smoking talaga is really not good for our health, pero. And to my far left is Von Vincent Tanchuan, communications lead of the Take Back Our Future campaign by the Positive Youth Development Network. The campaign aims to expose tobacco industry tactics in targeting the youth and to empower young people to take back their future by living healthier lifestyles. So, now, we go first to Dr. Sophie Brasnell. So, first, on the lighter side, how's your stay here in the Philippines?
It's amazing. Thank you so much for being so welcoming.
We are so fortunate to have you here, so you can give us more information, more insight regarding this HTP and vaping.
Yes.
So, what is actually the heated tobacco products? What is HTP, and what is the biggest misconception people have about them?
So, heated tobacco products are quite new. And I'll actually start with the misconception because it helps to understand what they are.
Right.
So often people think that heated tobacco products are vapes, and they're not. So with vapes, you have an electronic device, right, which many of us see. But what it heats inside is usually nicotine plus, flavorings and sweeteners and such things. With heated tobacco, we also have an electronic device. So that's why people confuse them. But the difference is that it heats tobacco, actual tobacco leaf. So if it contains tobacco leaf, it's a heated tobacco product. If it's heating just nicotine and flavorings, then it's an electronic cigarette.
So this HTP looks like a real, it's a gadget.
Yes.
Looks like a gadget, and
Yes.
it's very attractive
Yeah.
for the kids to be influenced or to try this, right?
Very sleek and modern.
And they have they also have flavors, or
Yes. So the way that you heat the tobacco, so you might be familiar with pods for e-cigarettes. So for heated tobacco, they come in like a little stick. It looks like a mini cigarette almost. And yes, they've started to come out in flavors like mint and menthol, but now we're also seeing coffee or berry flavors, fruit flavors, for example.
do you have any direct evidence on how this really impact the health of the people using this HTP?
Yeah, so we actually did a study that came out recently where we looked at all the clinical trials that had been conducted on heated tobacco products to date. And by clinical trials, I mean studies where human participants were given a heated tobacco product, and then the study investigators monitored impact on their health. And when we looked at the data, we found two really interesting things. One is that the findings on in these studies were very mixed. So you would think if the industry claims that HTPs are less harmful than cigarettes, that the data would show that they are less harmful than cigarettes. But what we did is we looked at each outcome, each finding, and we said, did the study indicate that heated tobacco products had a beneficial effect or a harmful effect? And it was really mixed, not just between the studies, but within the studies themselves. So the studies might find on some outcomes, perhaps related to areas of your health, like your lung health or your heart health, that there were beneficial effects compared to cigarettes, but then others found there were harmful effects. And so that leaves us in a really precarious position because it gives us no clear indication as to the actual health impact of heated tobacco products. And then the second finding that was really interesting was about the quality of this data. So it's already hard to interpret because it's so mixed, but we also found that the vast majority of these studies were funded by the tobacco industry. The very people who are trying to sell these products, which is a problem because they introduce bias. So we can trust the science even less. And they were also really short. So these studies, most of them were just less than 5 days. And I'm sure the doctors here, that's hardly enough time to see any true change to our health. So they're not great at actually telling us what are the risks of heated tobacco products.
So we cannot say that the shift to this e-tobacco is really will do good to those who want to quit smoking, right?
Yeah, so when you're thinking about these products, I tell people to think about 4 things. So the first is, do they reduce the risk of disease and death? And with heated tobacco products, we're not sure yet. The second is, do they help people who are smoking cigarettes actually quit? And right now, the evidence does not support that heated tobacco products can help people quit. In fact, it's the opposite. Lots of people who are using heated tobacco products continue to smoke. And in fact, there's some evidence to suggest they not only continue to smoke, but they're less likely to be able to quit tobacco, and they increase the amount of tobacco that they're using when they're using heated tobacco plus cigarettes. And then the third thing is youth and children. So it's all very well and good if it might be less harmful to a smoker. But smokers only make up, I think here it's around 30 or 40% of the population, maybe? 22, thank you. But the other 78%, these products can only do harm. And in children, they can only do harm. And then the last is, what about new harms? It's very easy to be less harmful than a cigarette, which has 7,000 chemicals and kills 2 in 3 users. But what about new harms that come with it? Children are eating the sticks and then getting nicotine toxicity, and the blades inside are hurting, like getting stuck in their organs.
They just think, or they thought that you're just taking in or having a good time, like candy or maybe something, a dessert or something. But this is really harmful. It contains nicotine and everything the chemical that's harmful to our health. Dr. Gonzalez, yes. What are some of the known or emerging health risks linked to the long-term vaping, especially among the youth?
Okay. Vapes are actually just here for 2 decades. So we have seen rises of uncontrolled asthma because the air particulate exposure. We have seen severe pneumonia because vape aerosol can decrease their humoral and immune responses to bacteria, viruses. And what is disturbing is actually the nicotine addiction. Once nicotine is used in the young, it makes them harder to quit. So it's like planting a tree and you water that plant with nicotine, so it's ingrained in them. And what is most affected? The brain. They use nicotine to cope with mental stress. They want the nicotine to increase their happy hormone, the dopamine, coupled with flavoring, which is actually, it's a quick fix. So we're not telling our kids that we should cope with stress with that. And what happens if there is nicotine addiction? Their mood, their learning, and their cognitive function are impaired, and that's permanent. Nicotine cessation for children is very hard compared to adults. We just can't use nicotine replacement therapy right and left because they are developing their brain and body. Number 4, we are contributing to environmental pollution. That air particulates given by the vape aerosol is actually much higher than those combustion from the what's that?
Vehicles.
From the vehicles. We used to say air pollution index 20 is safe. But do you know that air particulate from vape aerosol in an enclosed room can go as high as 80? That's dangerous. That's enough to cause inflammation of the airways down to the blood vessels. You don't see it yet because diseases takes lots of time. Children won't say that because they get the nicotine fix. They don't have the voice. That's why we pediatricians are their voices in the legislative, in press conferences. So what Dr. Blanches mentioned, the problem with children is they may not be the user, but they are the second hand and the third hand aerosol exposed.
Which is more dangerous.
They carry the same risk. They say that second-hand aerosol may contain less, but we don't have enough researches. But do you know that vape aerosol is water soluble? Where do vapers go? The young, in the comfort room. The tiles are actually porous, so the residues there last. We don't know how many years. So you see how dangerous it is? We are treading in a situation wherein we don't know the long-term use. And me as a pediatrician, I won't wait for another decade to see the catastrophic cancer because it takes 30 years. But we see the parallelism, the harmful chemicals, the marketing, and actually the consequences. So that's why.
Do we have any research on how many percent of nicotine is there in the in vaping or in vapes?
It's not a research, but industry has given us, right? 1 pack of cigarettes is 20 milligrams.
Okay.
1 stick is 1. But for vape, especially the new generation, the disposable, it can be as low as 3 or none, but there is really none, to as high. Our RA 11900 has allowed 65 milligrams of nicotine. And it's toxic. 1 milligram per kilo is enough to kill a child. 65 milligrams in a pod, they never know that they're consuming more than 3 packs of cigarette if they use that for a day. And what does it impact? Nicotine can trigger increased heart rate. It can increase also the blood pressure because it causes vasoconstriction. What is so sad, there are actually metal particles, and there are now reports that these metal particles causes faster endothelial dysfunction. And high nicotine doses, if ingested by the young, can cause seizures.
Wow, that's too bad. So